Hi, good afternoon, everyone. And thanks so much for joining us here today, where we're going to be hearing from Dr. Catherine Dodd on wireless smog and invisible toxin. This is Katie Huffling. I'm the Executive Director of the Alliance of Nurses for Healthy Environments, and so glad to have all of you here with us today. Just a couple of housekeeping items. For any of you that would like continuing education credits, and also even if you don't need the credits, we'd love to hear from you. After today's webinar, we'll be sending out a link to a recording of the webinar, which you're free to share far and wide, as well as a link to the post-test and evaluation. Anyone that needs continuing education credits from today will need to complete the post-test and evaluation in order to receive your certificate. And just an FYI on their certificates, it can take a couple days after you do your post-test for those to be sent over to you. So we are thrilled today to have Catherine Dodd, who is a registered nurse with a doctorate in sociology from the University of California, San Francisco. Most recently, Catherine served as the director of the City and County of San Francisco Health Service System, where she negotiated and administered health benefits for more than 112,000 county, school district, and community college district active and retired employees and their dependents. Prior to leading the health system, she worked for Mayor Gavin Newsom, now governor, as the Deputy Chief of Staff for Health and Human Services. And previously, she also served as District Chief of Staff to then leader, now Speaker of the House of the U.S. Representatives, Nancy Pelosi. Oh, and one thing before Catherine starts, also, if you have any questions for Catherine, please put them in the chat box. I'll be keeping an eye on those, and we'll be addressing as many as we can at the end of the presentation. And any that we don't get to, we'll take a look at after and send out information on answering those questions. So without further ado, I'd like to introduce Catherine Dodd.
Thank you, Katie. And I want to do a shout out to you for your work yesterday testing people in the Washington, D.C. area. And thank you so much for your service to our country in doing that.
Oh, thank you.
So I'm going to start today, and I want to first say that I'm relatively new to this field. I became immersed this time last year. I've learned from incredible scientists, many of whose slides are adapted for this webinar and are listed at the end. And there's much to go through, so I'll be speaking quickly. I did not include my email, but it's catherine.dodd@gmail.com, and they'll send that out tomorrow. And I also want to say that all the things I'm referring to are peer-reviewed science. These aren't conjectures, they are peer-reviewed science. The second thing I want to do is just make a vocabulary distinction. You often hear RFR, or radio frequency radiation, or just radio RF, and you hear EMF, electromagnetic frequency. They're both the same thing. EMF also refers to electromagnetic fields, but their radio frequency radiation is electromagnetic. So I'm going to start with, next slide, with the precautionary principle, which all of us environmentalists know about. When there's serious threats of irreversible damage, lack of full scientific certainty should not be used as a reason for postponing cost-effective measures to prevent environmental or health degradation. This was adopted in 1992 at the Rio de Janeiro UN Conference on the Environment, and it's as applicable here today as it is in all the work we do, although we actually have science on a lot of this. Next slide. In the U.S. President's Cancer Panel Report of 2009, it identified electromagnetic radiation, which is the non-iodizing energy generated by the multitude of wired and wireless technologies, as one of the several environmental toxins that many experts believe cause increased cancer rates. And it concludes by saying a precautionary prevention-oriented approach over a reactionary approach to environmental contaminants in which harm Human harm must be proven before action is taken to reduce or eliminate our exposure. So this has been acknowledged in the United States by the President's Panel on Cancer. Next slide. We are addicted to our devices. In many respects, substance addictions and behavioral addictions are very similar. They activate the same brain regions and they're fueled by some of the same basic human needs: social engagement, social support, mental stimulation, and a sense of effectiveness. Next slide. This cartoon has a cocktail party with a man with a dog cone on, and he's saying, it keeps me from looking at my phone every 2 seconds. How many of us can relate to this? But why do we go so far? Why do we spend hours at our phones browsing social media or answering emails? Next. This is really why we're concerned, because children's brains are being hardwired for intermittent rewards, and it's damaging the brain as well. And I'll revisit this later. But in a nutshell, Victoria Dunkley, a pediatric psychiatrist, has said, any device with an electronic screen acts like a stimulant. It's a central nervous system irritant, and it emits electromagnetic radiation. Next slide. Yet another cartoon of a baby in a bassinet at the hospital holding their cell phone, saying, "Oh my God, I just got bored." It would be funny if it weren't true, because you can see a very young child in the picture looking at a screen. Next slide. We've seen a rapid increase in the growth of cell phone use. In 2017, there were 400 million subscriber connections, and there was $179 billion in annual revenue. Next slide. The rapid growth in smartphone use is equally amazing. A review conducted by the Pew Research Center said that 95% of children, this is in 2018, had smartphones and used them daily. Next slide. This slide is kind of where we begin to talk about the science of electromagnetic radiation. Our electrical power is on the left side. It's at 60 hertz. That's what you plug into the wall. All non-ionizing radiation is biologically active. The waves get shorter as the frequency, or the hertz number, gets higher. So you can see AM/FM radio is at 540 kilohertz to 108 megahertz. Cell phones are at 850 to 2600 megahertz. And Wi-Fi, which we're probably all using right now, is 2.4 gigahertz. We're talking about the left side of the graph, the non-ionizing side. There's not enough energy to break chemical bonds or ionize atoms. The high energy photons, which are on the right side, X-rays and UV rays, are dangerous because they break those bonds. Our non-ionizing radiation goes from 30 kilohertz to 300 gigahertz. It's microwave radiation, you'll hear about, is used in 5th generation or 5G begins at 300 megahertz and extends to 300 gigahertz in millimeter length. It goes on tetrahertz, on and on. But what we do know is, while they don't break molecules apart, they do break DNA apart. The next slide just looks at a couple of devices that are ionizing wireless devices. They send microwaves 2 ways, from a phone to an antenna, from a laptop to a modem, from a cordless phone, which sends it to itself but also transmits constantly to an antenna 22 miles away, from a baby monitor, from headphones to our device. These are constantly emitting when they're in use, and they may even be emitting when they're turned off. Next slide. Another funny cartoon that says, "That's right, dear, our ancestors had tails." Well, I'm hoping that by the end of this presentation, you'll want to reinstall your landlines with cords, or you'll want to Ethernet your cell phones. The next slide talks about the generations of cell phones. And that's what the G stands for when you hear of 1G, 2G, 3G, 4G, etc. In the 80s, those of you who remember this, we had analog voice. In the 90s, we had digital voice and text. In the early 2000s, we had browsing and the internet. And beginning in 2010, we were able to use video. The 5G or fifth generation of the internet will be the Internet of Things, which is being promised to us. On the right-hand side, I point out that early cell phones had just one antenna, and that was why it was associated with largely with brain tumors. Today's cell phones have at least 6 antennas for voice, data, Wi-Fi, Bluetooth, GPS, and RFID. And we're seeing, because a couple of those are located at the bottom of the phone, more rotted and salivary gland tumors at the location of that antenna. Next, I just want to tell you that RFR is everywhere. When you're standing outside of a car, it can be measured. When you get in the car and you turn it on and driving, there are multiple sources. There's Wi-Fi, Bluetooth, anti-theft tracking. It's just Wi-Fi is everywhere. And I want to point out that if you forget where you've parked your car, you can take your little wireless key fob and you can put it on your head and click it, and our body's electricity will extend that Wi-Fi to help you find your car. Just a little trick. The next slide shows you what a smart house is like. With a 900 megahertz router, all of these 2.4 gigahertz, remember that's where our laptops are, all of these devices are sending and receiving radiation. Whether it's washing machine, your computer, your microwave, your DVD, your television, your laptop, your thermostat, even your toys, your speakers, all of those are sending and receiving radiation. Next slide. Again, microwave radiation surrounds us. Literally, we are sitting in microwave smog unless we're in the middle of a forest somewhere. And our national parks are now adding 5G, so the forests aren't even that safe. The next slide talks about the different names that you'll hear, and I was confused for a long time about what was what. So you'll hear cell towers, small cell antennas, close proximity microwaves, personal wireless facilities, or personal technology facilities, or 4G antennas, 5G antennas. They are all base stations, and they all use different frequencies, and the 5G will add in those high millimeter waves. The next slide shows you that distance is our friend in wireless, that the farther away you are, the radiation decreases in its strength. So being close to a huge MIMO antenna is not a place you want to live. Being directly across from it, at least if you're farther away, you're getting less radiation. Next slide. That's the distance is true of the indoor devices and your cell phones as well. Antennas differ greatly, and I'm just going to go through this quickly because I walk around and you'll start doing that and looking up and thinking, well, what is that? The big ones are macro cell towers. The little ones that are on top of light poles or telephone poles are small cell towers. And we were beginning to see antennas disguised in trees or in water tanks so that people don't know that they are, so they're not so intrusive. The side on the right, this part on the right shows you flush mounted, right on the pole. It shows you on top of the pole, but it also shows you that it's right next to a window, and that we're getting zapped. Next slide. The telecom industry is creative. They're now putting everything in a pole and making it look very pretty. So don't be don't be misled. Next slide. I have tons of slides of antennas. These are some 4 and 5G installations. And what's important is in the one on the right, all the installations need a box for their ancillary equipment, and many of them need supply cabinets with batteries. These are lithium batteries. If a car hits them, they can arc and explode, and right now cities are not allowed to regulate where these go. Next slide. This is a sad slide for me. It's an antenna outside the bedroom in San Francisco where I live. Most local ordinances require a minimum of 15 feet away. San Francisco passed an ordinance in August of last year that said they could be as close as 6 feet from windows, schools, and homes. Next slide. And remember, they have a 3,000-foot radius of where their radiation is going. This is the last antenna slide. I just want you to be able to distinguish between primary electric distribution, which are the top skinny lines at the top, and then further down the middle is where you see a receiving antenna. That's not to say that those electric distribution antennas are safe. We know that they need to be away from schools, but they're not the same as wireless radiation. The last antenna slide, I promise, shows you how we're seeing 5G and antenna densification. Each different company can put up their own antennas. They can also pile onto each other. So in San Francisco, we can have 4 different companies with antennas on one pole. So it's not like you're going to be 800 or 1,000 feet away. You can have antennas, because there's so many of them, that are only 300 feet away. And all of them are sending out wireless radiation. This slide, the next slide, talks about the difference between 5G and millimeter waves, 5G millimeter waves and 4G. So 4G waves are longer. They are between 700 and 2700 megahertz. They can go through buildings, and go through forestation and objects. 5G waves, higher frequency, are shorter. They transmit data much, much, much faster, but they get blocked by buildings, which is why they have to be so close together. Although some companies are trying to use those tall antennas and the MIMO waves, which are explained on the next slide. 5G elements are millimeter waves. Those tend to interact with your skin and sweat glands and along your acupuncture meridians. Small cell antennas are beam forming. They don't send out an array, they send out a beam. The massive MIMO tall antennas help get past objects. The phased arrays go specifically to devices. And the last piece is that right now a lot of things overlap, which is why all of our internet has slowed down during this time when we're all online, because there's so much stuff on the waves. These allow specific lines for each device, or a full duplex. Next slide. This again shows the difference between the active array, the 4G, which looks like a cone, and the 5G, which goes to each specific device. What's important is those are on top of each other. You can't have 5G without 4G. 4G is usually for the communication and radiation. 5G is for data. Now, next slide, you've heard of the Internet of Things, and we've all been promised driverless cars. And the main company in England working on it has designed these antennas that will be put in the ground, so you won't lose connection from antenna to antenna, because they'll be very frequent in the ground. Well, that may all be well and good, but if you have any kind of implanted sensor, that continuous 5G will trigger people with electronic devices in their bodies. And the number of people like that is very significant. Next slide. We've all heard of SpaceX, and on May 23rd, Elon Musk launched 60 Starlink internet satellites. There are currently about 180 satellites in orbit. Ultimately, there's a goal of 42,000 satellites in the near-Earth orbit. This is what you call a nightmare for space junk. It's a nightmare for many scientists, astronomers, and weather predictors. I'm forgetting the name of them. Anyway, the next slide. Is the wireless radiation toxic? I wish we could have these kinds of labels on every single antenna. Next slide. We are all electric human beings. As nurses, we've seen EKGs. Those measure electricity. We've seen EEGs. Our nerves transmit impulses. We measure our brain waves in delta waves, theta waves, alpha waves, and beta waves. We are all electric. So anything that's electric is going to interfere with this. Next slide. The debates on microwave dangers actually began in during the Second World War, when Dr. Alan Frey was investigating what was called the hearing effect, which were little clicks that were heard by the radar transponders. He later published on that and called microwave hearing non-thermal effects. He also discovered and published on the blood-brain barrier effects of microwave radiation. The other key figure in early research was Dr. Hermann Schwann, who helped to define the currently used thermal approach to measuring microwave radiation. He was the founder of the Institute of Electronic and Electrical Engineers, the IEE, which we still rely on, unfortunately, today, rather than relying on health experts. And he's best known for pointing out that there are non-thermal mechanisms of interactions with biological systems. It doesn't have to heat you up. That low-dose non-ionizing radiation has effects on biological systems. Next slide. These are examples in the early 1970s, and the Naval Medical Research Institute published a report on harmful thermal effects of radiation, and the Defense Intelligence Agency in 1976 also published a similar document. People say, we need to do more research. We need to do more research. Well, we do, specifically on 4 and 5G, but there are massive amounts of research on non-ionizing radiation and health. And I rely on the bioinitiative.org, which catalogs nationally and international research on this. We have our own non-toxicology program, which was within the NIH, and I'll talk more about that. And then, of course, the International Agency for Research on Cancer published their landmark position in 2011. But the economic factors of the telecom industry have prohibited really looking at what the effects are and changing the safe levels. Research today is harder to do because our entire populations are exposed to multiple frequencies. So a lot of research is being done in European villages as towers are being put up because the people haven't been exposed before, but they almost immediately have symptoms. So the IARC in 2011 said that electromagnetic fields, EMFs or RFRs, were a class 2B carcinogen. They're in the same class as arsenic, insecticides, DDT, chloroform, dry cleaning fluid, engine exhaust, gasoline. Many scientists believe if they revisited it, it would become a class 2A carcinogen. I mentioned our 2008, next slide. I mentioned our 2018, oops, we skipped that one. That's the 2011. Next slide, sorry. Next slide, sorry, I got ahead of myself. Here we are. I mentioned the 2018 report from the NTP. The National Toxicology Program is inside the NIEHS, the National Environmental Institute for Health Science, and that's inside the National Institutes of Health. In 2018, their report said there was clear evidence, that's the highest classification, clear evidence that radiation from mobile phones causes cancer, specifically a heart tissue in rats, and some evidence of cancer in the brain and adrenal glands. Next slide. This study was funded through the EPA and the FDA. It was a $20 million study. It took 10 years, and in order to get the results, in order to get the findings public, we had to file a Freedom of Information Act request. Dr. Ron Melnick, the senior scientist, now retired, is a frequent speaker on the integrity of the study and on the dangers of microwave radiation. There was clear evidence of malignant schwannomas, which are heart nerves, of male rats, some evidence of malignant gliomas brain in male rats, some evidence of tumors in the adrenal glands of male rats. The evidence was equivocal for female rats and for both male and female mice. So let me see. In terms of the gliomas, in terms of the science itself, people often criticize it. Why do we use rats? These are genetically identical Sprague rats, which allow you to have a control group and a non-control group. This research was replicated exactly by the Rasmini Institute in Italy, which is like our NIH, and the findings were identical. They even did it again with lower levels of radiation and had identical findings. So should we be concerned? Well, from 1995 to 2015, glioblastomas have increased 10%, and while they're leveling off, we're seeing other tumors close to where the cell phone antennas are, and I'll show you a slide of that soon. Next slide. What else did the NTP study find? It found increased degeneration in the hearts of male and female rats, decreased birth weights in rats that were exposed prenatally, and the overall tumor incidence in the male rats was greater after 2 years of exposure. Next slide. So what do Trump's U.S. health agencies say about the NTP? And remember, we had to file a Freedom of Information Act just to get the results. Well, I've told you what the NTP says. The CDC says nothing. The NIH says they were small numbers of cancers. The FDA says we disagree with the conclusion, and the EPA website sends you to the FCC. We know how much the Federal Communications Commission knows about health. Next slide. Scientists and physicians all over the world have created this 5G appeal, which calls for stronger EMF regulation and provides warnings. It was signed in a year, it was signed by 247 different scientists involved in this kind of research. They had published over 2,000 papers, and they were from 42 nations. This is a global issue, and they warn, and we warned our UN, that 5G will substantially increase exposure to radio frequency EMFs on top of 2, 3, and 4G, Wi-Fi, etc., and that that RF and EMF has been proven to be harmful to humans and to the environment. Next slide. So scientists and health experts contend that RF exposure guidelines are not protective. They were in place in 1996. They were created by that IEEE. They only consider heating effects, and they have not been tested on 4G and 5G, and they haven't looked at the non-thermal issues that occur. Next slide. I should tell you, this is exciting, that 2 nights ago, while we were in the midst of watching CNN and MSNBC and watch the numbers go up on the pandemic, the FCC issued their final guidelines, which they began in December during the holiday season, and their guidelines on reassessing what the levels should be did not change at all. There was no change. So what does that mean? Well, it means that if you live close to a tower within 300 meters, you may experience some of these symptoms. We've talked about it a lot. Then next slide. This is a slide from a 2009 graphic presentation, which warns about all the things that have been replicated in our more recent research. Brains, hearts, testes, fatigue, ear burning, and numbness. Next slide. And if you're sitting with a laptop on your lap right now, this will have you move it because the Environmental Health Trust has done simulations that show the peak exposure from a laptop actually extend throughout your whole body, but primarily around your core. Next slide. EHT also reports on the thinning, the decrease in testicular walls, and the lower viability of sperm. This is directly related to keeping your cell phone in your pocket. The Mayo Clinic advises specifically to keep your cell phone away from you, and your cell phone and your devices in the RFR guidelines under settings actually tell you to not have your device closer than 5 millimeters to your body. Next slide. We're seeing more and more young women put their cell phones in their bras because they don't want to be able to dance at their raves. We don't have epidemiological research on this, but there is increasing numbers of case studies that show that the tumors are right below the cell phone antennas. These are on young women with no family history. They're negative for BRCA1 and BRCA2, and they have no risk factors. Next slide. I mentioned the other cancers, acoustic neuromas, that also can cause facial paralysis, parotid tumors and glands of the cheek. Thyroid cancer is increasing in both US and Korea, and we just spoke about the cell phones in the next slide talks about electromagnetic hypersensitivity. We are estimating in Europe and the United States is reporting. There is, since 2018, we've had an ICD-10 code for it. It's W90.0, and then there are W90.8 and other sequential numbers. This is a legitimate recognized disease. What are the symptoms? Some of them we've talked about before, but moving difficulties, low appetite, cardiovascular problems, feeling difficulty concentrating, fatigue, headaches, etc. Next slide. In California in 2004, firefighters reported feeling foggy. They were having trouble sleeping. They were exhausted, and they had memory loss. One firefighter who grew up in the town got lost when he was out on a call. They agreed to have SPECT brain scans, and they voluntarily did this. And if you go to the next slide, Dr. Hauser published on it in, next slide, I'm sorry. Dr. Hauser published on it and diagnosed toxic encephalopathy. And in fact, the firefighters passed legislation in California that prohibited the placement of antennas in the firehouse. Firefighters that kind of exposure. And these are antennas. These are the big things. I'll also just suggest that as you drive around or walk around and you see church steeples, many church steeples implant antennas on them because the company will pay you to have that antenna there. It's the same kind of antenna that was on top of these firehouses. So on the next slide,
1, 2, 5.
on the next slide, it just kind of talks about the different biological effects of electromagnetic fields, oxidative stress, DNA damage, calcium channel effects, blood-brain barrier leakage. I'll go into a couple of these, which I think are important. The first being the next slide, calcium channel leakage. In 1981, Dr. Ade discovered that there was an electromagnetic frequency at which cells opened up and allowed calcium to flow in. That voltage just opened up a channel in the cell. Excites the cell, the more calcium, the more excited. This is called the Ade effect. And Peter Sullivan and many others, Dr. Margaret Herbert, have done research on autism, found that there are about 1,000 genes, with a large cluster of them being risk factors that are sensitive to calcium channel signaling variations. And they're also a risk factor for adult electrosensitivity. So we're seeing increases in autism, and one of the things that's significant is that when you remove kids from a radiation on RFR environment, and you put them out in the country, or you put them in houses that are painted with RF blocking paint, and you limit their exposure, they improve. And Peter Sullivan's a very compelling speaker on this. I've listed his website at the end of this talk. The next slide talks about oxidative stress. This particular article is a review of 80 papers on oxidative stress caused by RFR, and 76 of them, or 92.5%, showed significant effects. Now, we often hear about oxidative stress, and it's the imbalance between free radical production and our body's ability to counteract those ions, those free radicals. Oxidative stress decreases our melatonin secretion, which is important melatonin is our most powerful antioxidant. That's why during this time when we're all indoors, we need to get outside and get some sunshine, because that increases our melatonin. Of course, other stresses also cause oxidative stress. So we are all probably operating with a higher level of oxidative stress, and then we're just piling on the wireless smog that we're sitting in. We know that this stress causes DNA damage, cancer, neurological effects. It's also implicated in aging and metabolic diseases. Next slide. So we're going to skip to the brain, which is affected by oxidative stress, but next slide. We're going to specifically first talk about the blood-brain barrier. And microwave, the first time they talked about whether or not microwaves could impact the blood-brain barrier was in 1975. And since then, there have been numerous studies using largely a 3G cell phone. We've seen cognitive impairment in rats. We've seen increased blood-brain barrier permeability up to 7 days after exposure. This is research from 2015, so it's not old research. We've seen changes in gene expression, leakage of alpha, and any number of studies about the blood-brain barrier and exposure to what you would get from a 3G phone. The next slide talks about wireless radiation as a neurotoxin, the loss of brain cells in the hippocampus, which affects our memory, oxidative stress, which I talked about earlier, but it affects inflammation in our body, decreased neurotransmitters, our oxytocin goes down, our mood changes, and demyelinization and a disturbance in the system signaling. Next slide. So Dr. Dunkley, who I mentioned at the beginning, discovered that RFR contributes to gray matter atrophy, a thinning of the cortex, white matter fragmentation, reduced dopamine receptors and transporters, etc., etc. In the next slide, this is again an early slide that talks about the parts of the brain that are affected. The frontal and temporal lobes, the largest parts, absorb the most, and we'll talk in a minute about the SAR, the specific absorption rate. But this explains, this is associated, the 900 megahertz to 1800 megahertz Now remember, your laptop is 2.4 gigahertz, so we're talking low exposure, but they contribute to brain tumors in the frontal and temporal lobe. Next slide. So what is the SAR? The SAR is the specific absorption rate of radiation. It's a measure of the maximum power emitted under one frequency. So how do they do it? They take dummy heads that contain a sugar-like liquid. They don't have organ-like densities. They're just liquid. And they expose them to the radiation until they heat up by 1 degree. And that would be a thermal effect. Now, these dummies don't simulate for a child's brain. They're based on an adult male. And they're based on one signal. Most smartphones today use several different frequencies in a single call. So the SAR levels are grossly outdated, but nonetheless, that's what we have to use. Next slide. Neurological effects, again, are underscored. We see Eeg effects with cell phone use and with exposure, cognitive impairment, headaches, dizziness, key behavior changes, especially in children. Next slide. Neurodegeneratively, the impaired mitochondria function that is caused by wireless radiation is associated with all of these diseases: depression, bipolar disorder, panic disorder, chronic fatigue, etc. And many are accompanied by brain inflammation and that oxidative stress. Next slide. This was a surprise to me as a type 2 diabetic, that we knew as early as 1971 that wireless radiation contributed to increased blood glucose concentration and a change in the concentration of glycogen in the liver, etc. Published by the Naval Medical Research Institute, but well hidden. Next slide. Our bodies, in terms of diabetes, our pancreas has poor defenses against oxidative stress. RF triggers a cellular stress response. Many diabetic complications, retinopathy, cardiovascular disease, etc., and are linked with oxidative stress. So this radiation has special implications for people with diabetes. But on the next slide, you'll see that Medicare is now covering the Dexcom wireless glucose monitoring system, exposing you again to wireless radiation just to measure your blood glucose. It's a nice alternative to sticking your finger 4 times, but I'll avoid the radiation. Next slide. This is a very compelling area. What are we doing to our children? With all these kids, all their radiation, irradiating each other. Next slide. Children are more vulnerable to wireless electromagnetic radiation. Their skulls are thinner, they have a higher content of water in their brain and in their bodies, and they absorb 2 to 5 times more radiation. And you can see on the right, the left head is an adult and the right head is a child. So look how much further the radiation in the simulation penetrates the child's head. And again, looking from the frontal and the ear cell phone. We've known for 9 years, the IARC in their 2011 monograph said that radio frequency fields affected children more, and that their skull's bone marrow absorbs 10 times the radiation compared to an adult. Next slide. So grateful to the early action of the American Academy of Pediatrics, who in a 2012 letter to the chair of the FCC said children are not little adults. They are disproportionately impacted by all environmental exposures, including cell phone radiation. And the AAP website has some great advice about how to protect kids from wireless radiation. Next slide. This is another simulation of absorption. These are the important one that they pointed out here is that the absorption to the eyes was 2 to 5% higher, and that by age 12, they point out that 75% of kids use cell phones. So many countries have banned cell phones until age 16. A child absorbs 2.5 times the radiation of an adult, and we just can't forget that, especially during these times when all of our kids are using wireless to study and play indoors. Next slide. Looking at that tablet, that child is getting radiation to their frontal lobe, to their face, to their eyes. This came from an article called Specific Absorption Rates in the Heads of Tablet Users. And it's a warning to us. Next slide. So public health often talks about first-hand, second-hand, third-hand exposure. So we have the smoker, the kid in a room with someone smoking, and then we have the smoke and smog that's outside, or the smoke from the recent fires. In wireless, first-hand, second-hand with the father looking at a laptop and the two kids playing on a tablet, and third-hand, a cell tower outdoors. The next slide takes that model and looks at first-hand, second-hand, and third-hand and simulates the radiation exposure. And I don't need to really add anything to that description. Next slide. More screen time for kids is more stress to the nervous system, raised stress hormone, and altered brain chemistry. Again, Victoria Dunkley reminds us that an electronic screen is like a stimulant. It's a central nervous system irritant, and it emits electromagnetic radiation. Next slide. She talks about electronic screen syndrome, where we see dysregulated mood, irritable, tearful, depressed kids, impaired cognition, poor focus, dysfunctional behavior, lack of empathy, reactive, perceived hostility, poor eye contact, symptoms of this electronic screen syndrome. Next slide. This is where our environmental work in terms of toxins in the environment. It's one of the first studies that looks at co-exposures, and it looked at high blood lead levels in kids who use cell phones, and saw much more symptoms of ADHD. The second study is a delayed neurodevelopment, increased risk of having poor or delayed neurodevelopment up to 36 months in age, associated with cell phone use during pregnancy. And there's all of these have great research studies that associated. The next slide talks about memory loss in teens. This was a Swiss study with 827 7th through 9th graders. It was a 2-year study that was done in 2 waves, and they found decreased performance in adolescents from cumulative exposure to cell phone radiation. Next slide. 60 Minutes took this issue up as early as 2018 and talked about how teenagers are spending 4.5 hours a day, probably more now, on their cell phones, and they look at their cell phones every 15 minutes. Next slide, they also reported on the brain research that have been done that talks about the thinning of the brain cortex for kids who use screens up to 7 hours a day. So what are we doing now that all learning is being online? The next slide talks about a wonderful speaker and scientist, Dr. Nicholas Kardaras, who's a tech addiction specialist. He goes through the dopaminergic experiences that activate in the brain's pleasure center that are as significant as sex, he says. Brain imaging studies or loss of tissue volume for internet gaming addicts. This is a real detrimental health issue. Next slide. So in schools, and although kids aren't in schools, hopefully they'll return, but in schools they have outdoor sources, towers, and they have indoor sources. They all have cell phones, they have laptops, they have wireless printers, they have cordless phones and Wi-Fi in general, even wireless exercise equipment that kids are exposed to day in and day out. Next slide. And these aren't one-time exposures. These are constant. So we do know that cell phone use increases distraction and decreases learning. In London, they found that there were higher test scores where they banned cell phones. Although here we found decreased cognition function in adolescence. But remember, 95% of kids have smartphones and 45% use them almost constantly. Next slide. There's research on speech delays that was done by the American Academy of Pediatrics on ADHD and on neuropsychiatric effects. The neuropsychiatric effects included fatigue, headache, and nausea in kids. These are serious effects caused by everyday exposures. Next, Dr. Dunkley, again, talks about what we can do to reset our children's brains. She talks about going on an electronic fast, something I would like to do, and only use wired devices and spend more time outside. Don't let schools use laptops because screens dysregulate our body clock. They create a mismatch of high arousal but sedentary existence. So you're sitting, but you're aroused, as opposed to being outdoors and being stimulated and aroused. Next slide. She recommends, these are just some of her recommendations, but they were house rules, and I want to emphasize no screens or cell phones in the bedroom. That's true for us too. One screen at a time. Use a device basket when kids come into the house. And Mom and Dad have to apply by the rules too. So that next slide, which you're looking at now, says, no, go back. Shouldn't you be reading a book? And Dad's watching videos while the kids watching videos too. There you go. So what about, we've talked about kids, what about reproduction? I'll be quick here. Sperm, there's over 40 studies on motility, DNA and testosterone. Ovarian, we have 9 studies, embryonic damage. There are serious risks to reproduction. Next slide. Dr. Henry, I think it's Henry Lai, did a cohort study in Kaiser in Northern California, and he used just magnetic field, non-ionizing radiation, not electronic, and found a two-time increased risk for miscarriage and increased risk for offsprings with obesity and diabetes. Next slide. There are environmental issues that cannot be ignored. EMF disrupts birds and bees' orientation. They don't find their way back to the hive. There are also global warnings. Today, the internet makes up 2% of global electricity consumption, and by 2030, the Internet of Things is estimated that it will be responsible for 23% of greenhouse gas emissions and will use 51% of total global electricity. It's not just the use of electricity, it's what embodied energy is in those devices, from mining the minerals to making the device in smelters, to creating them, and then ultimately to throw them away. All of our data is sent to giant data storage warehouses. They're so big you can see them from space. They're constantly refrigerated with electricity. Remember that photos take more space. They use more, streaming uses more energy. So teleconference with voice only rather than Zoom when you can. And you are Zooming, turn on Zoom so you can see who's there, but then go to voice only and you won't be using up as much energy or data space. This next slide got out of order, but it, I think, next slide. It goes back to the bees, and this is a exposure, again, to radiation and what it does to our pollinators, and has serious implications for the world. Next slide. So what about this telecom industry? Next one. You should know that insurance companies, the largest insurance companies worldwide, have refused to insure telecom companies. And Verizon, Crown Castle, and Swiss Re have all warned their investors that they may be subject to lawsuits related to health damages. So they know the truth, kind of like big tobacco, if you recall. Next slide. In the midst of this, I want to call out one state that, through the work of a nurse who's on the phone, Dr. Barbara Sattler, who helped found Maryland's Council on Children's Environmental Health and Protection. They were one of the first to make a recommendation that the Maryland Department of Health and Mental Hygiene should provide suggestions to the public on ways to reduce exposure. So this is to say that each one of us has a role, individually and collectively, in decreasing exposure. Next slide. In the city of Berkeley, they passed a law that required that places that sell cell phones, I'm almost out of time, have notices posted. The CTIA sued them, and they sued, and they're back posting them. The CTIA is going to sue them again. Next slide. We had to sue the state of California to finally produce recommendations that had been in existence for 8 years. Next slide. All of these countries have some kind of warning about devices and electronic cell phones in particular, except the United States. And the United States, we have our CDC saying, well, if you're worried about it, keep it away from your body. Next slide. This one's important. It shows you how different our levels are. We allow that tall bar on the right. That's how much exposure we allow compared to all those other countries. Literally 100 times more than India, 1,000 times more than China. Move on to the next slide. I'm almost done. What is the federal government doing to protect us? I said earlier, on March 31st this year, they reissued their standards with no change. Since 1996, all the presidential appointees to the FCC have been telecom stooges, and the Telecom Act preempts all state and local ordinances regulating where you can put a telephone. So right now, the guidance that came out in 2018 insisted that approval for wireless facilities be streamlined. They have to be done within 60 days. And we're seeing residents locally protest at their city council meetings saying they don't want antennas in their neighborhoods. Next slide. This just shows you the FCC. The chair, who you often hear from, is a former communications director for Verizon. Another one of the members, lobbyist for Nokia, and his wife is a high-ranking staff person in the Republican committee structure. The list goes on. Every member of the FCC is connected to the telecom industry. So on the next slide, you'll see a great book that you can download called A Captured Agency: How the Federal Communications Commission is Dominated by the Industries it presumably regulates. This is done by a Harvard ethics professor. Next slide. Telecom is predicting big money, and they're going to predict even bigger money by the time this pandemic is over, because in the CARES Act, we allowed $200 million to get 5G to rural areas going to the FCC. In the next slide, we show you that Ericsson predicts a 400% increase over the next 4 years. Next slide. There are a couple of good periodicals. The Nation has produced good reporting, and Microwave News is relatively independent. But I'll say that most of the media outlets are owned by telecom. So what we get is not the truth. There are many New York Times articles that are saying that all of this science is hooey. This is all peer-reviewed science. And the New York Times is partially owned by a telecom company. So in the next slide, you'll see a little telecom lobbyist in a cartoon saying, there's a new study saying radiation causes brain tumors, infertility, headaches, nausea, and cancer. Bury it. Business is booming right now. And that's exactly what they do. They bury the research. Next slide. We actually, Dr. Lai did research and compared industry-funded studies to non-industry funded studies. The non-industry independent studies showed 70% of them showed harmful effects. The industry-funded studies, only 32 of them showed harmful effects. So look at who funded the study. Next slide. This is just to say that in January, the Senate already passed legislation to increase by 125 trillion devices by 2030. That's only going to go up. The next slide shows you some of our friends in Congress, although these are not necessarily people who will talk about the wireless radiation and health, but they will talk about the importance of local governments controlling who gets to do what. The next slide talks about reinventing wires. What we need to do to get out of this mess is do lines to and through the premises. We put electricity via a wire into every house. We can add fiber optic communication cables into every house, into every building. We don't need this telecom wireless radiation mess. And I encourage you to check out safeg.net, encourage your local governments to not let wireless come into the schools and into the town, but to insist on doing wired to and through the premises. The education has to be at the local level, state level, and national level. So go next slide. What can you do to yourself today? This is a very short list, but the easiest thing is to put your phone in airplane mode and turn off the Wi-Fi whenever you're not. Plug it entirely at night. Absolutely do not keep it in your bedroom. Consider getting a Faraday holder. It has metal around it. The exposure can't go in and out. Keep your phone and devices away from your body. Use a speaker. Try not to use it in the car because the radiation just bounces off the wall in the car. Turn off your modem at night. You'll sleep better. Don't listen or watch streaming. Download things, listen and watch. Make sure children aren't using streaming. Many resources in subsequent slides, which I think you'll be mailed tomorrow. If you go back and put in a corded line for your home office, that's where you spend the most of your time. But if you can't, you can add an Ethernet connection for your phone, but you can also do one for your computer. It's very inexpensive and it's very easy to do. Even me, a techno, Luddite, can do it. Use a cord mouse, not a wireless mouse, and then your hand won't begin to feel tingles. Try and cord things. Don't rely on wireless radiation. I'll end by saying that the tobacco industry told us that cigarette smoking was safe, and we believed it. It took 7 years to see the initial lung cancers, but we continued to believe that it was safe. The building industry told us that leaded paint was safe, and I think that putting wireless in schools right now is just like repainting them with leaded paint. The beverage industry told us sugary beverages were safe. The pesticide industry continues to tell us that is safe. The cosmetic industry told us and sells us chemicals and care products saying that they're safe. And now the telecom industry, that's dominated by 3 major corporations, some of the largest in the world, is telling us that wireless radiation is safe. And we must insist that it be tested for safety. So stay safe, and thank you for your attention. And the next couple of slides, oops, sorry, I didn't say slide, Katie. You can keep going. Next slide. It's your line. Next slide. This is tobaccoless. So resources. These are just resources. I would highlight Physicians for Safe Technology and the Environmental Health Trust. You name it. And then the last 2 slides are some of the presentations that I on the people who do them to put together a slide presentation. And I thank you for your time and patience.
Thanks so much, Catherine. That was really great. We've been getting lots of comments in the chat. Just thanking you for the presentation and how great the information was. I know we're a little over time, but if I could put in a couple just quick questions here that folks had asked. And then if any of you think of any other questions, just shoot us an email. And I've heard from a few of you that you'd really like to have an opportunity to have a conversation around this and to talk about how Annie nurses can be engaged on this. So we'll try to get Catherine back on one of our policy and advocacy work group calls where we can have a robust discussion about this. But one of the questions was, can we protect ourselves by having, I think, like a disclosure mandated in a home inspection when buying a home, kind of like radon testing, if you're buying close to towers near your home?
That's a great question. And I'll tell you that if there's a tower near your home, your property value goes down by 20%. The American Association of Realtors continues to do this research. Right now, there is a disclosure in sellers' papers, but how many people really read those? It's not a disclosure for how much radiation is there, but it is a disclosure that a antenna is close by.
Another nurse is asking, did President Obama do or say anything about this topic during his presidency?
President Obama appointed one member to the FCC, maybe two members, who were telecom industry connected. President Clinton signed the 1996 Telecommunications Act, but President Trump has discounted the major $20 million research that we've done and appointed 4 more people to the FCC who are directly related to the telecom industry. It's bipartisan poison.
So frustrating. Oh. Well, thank you very much, Catherine. And for everyone on here, thanks so much for being on the call today. And be on the lookout for an email from us with a link to the recording and a link to the post-test and evaluation. And we look forward to connecting with all of you soon, and be safe out there, everyone.
Thank you. And all the nurses should join Annie.
That's right.
Thanks, Katie.
Thanks. Take care.
Bye.
Bye-bye.